implications. Recent pandemic. Is it a boon to the Ayurvedic fraternity? Maybe. This is because the global scenario of Ayurveda had changed before and after the pandemic. The world started looking upon to the alternative system of medicine, mainly Ayurveda, for the therapeutic and preventive management of the pandemic. And also, the world started to believe that Ayurveda can promote their positive health by modulating and regulating their immunity. Is it true? Does Ayurveda stand up to their belief? Yes, as Ayurveda kinship, we all strongly say yes. This is because Ayurveda is blessed with the most potent treatment modality, and that is the Rasayana Chikitsa. So whenever we say Rasayana Chikitsa, they say Rasayana is Jara Vyadhi Nashana. Of course, but then why did our Acharyas advocate Rasayana Chikitsa right from the stage of neonate itself, like Swarna Prashana Samskara? Why was it indicated from the age of first year itself, first year to 10 years, that we have to take Kushmanda Rasayanam, 10 to 20 years also Kushmanda, 20 to 30 years it should be Trifala, like this, according to the decade different Rasayanas are indicated. This is because our Acharyas had a wonderful vision that Rasayana is nutraceutical in its action, regenerative in its action, immunomodulatory in its action, antioxidant in its action, and all these actions are performed by the Rasayana at a very subcellular level. So when such actions are performed in a body, this leads to the formation of healthy tissues. So all that was described by our Acharyas in only one sentence, saying Labhopayo hi sestanam rasadinam rasayanam. So when we say Rasayana, I think an instinct had come to all of your brains that, oh, maybe even I also would have started Rasayana at some stage of my life. Yes, but which Rasayana has to be taken is a doubt. Now, which Rasayana has to be taken depends on the purpose of which you are intended to take that Rasayana. For example, suppose you all assume that I am a weightlifter and I want I am a medalist in Olympics or something like that. And I want even my children also to be weightlifters, and I want even them also to secure medals in Olympics. So in what way will my thinking go? I will think that my children also should have a good muscle tissue, they should have a good strength, and such that they can be future bodybuilders and all. So for that purpose, I start giving them Ashwagandha Gruta or Ashwagandha Rasayana, which is Bala Mamsa Vardhanam. So something which is given for a specific purpose is what is called as Kamya Rasayana. If not like that, we all want our children to lead a very healthy and a happy life. For such purpose, for their general health and to have a very good immunity, we give them Shira, Gruta, all these which are called as Ajashruta Rasayana. If not that, if you want to take Rasayana for a specific disease, for example, if my mother is a diabetic, I don't want to have diabetes. Or if I have diabetes, I don't want to face the complications of diabetes. So for that purpose, I want to take a special Rasayana which is specifically indicated for that purpose, like Silajitwadivati, Nishamlaki. So something which is taken for the prevention of some specific disease is what is called as Naimittika Rasayana. So such Rasayanas, many type of Rasayanas are described in Ayurveda, and they should be used according to the purpose which you want. So when we say Rasayana, we all know that it is giving balya to the body and it is improving the ojas quality of a body. That is nothing but what is called as immunity. So according to, in human body is the most complicated gadget with numerous mechanisms going on in it, and one of the most beautiful mechanism is the immune mechanism. But please keep in your mind that immune mechanism is not just a single man show. It is a congregate network of many systems like the gastrointestinal system, the nervous system, the psychological system, and the immune system. So first I want to speak about the gut immunity, because our acharyas had very beautifully told that Roga sarve api mandagnav sutaram udaranicha. That is, all the diseases arise from the gut. This was also told by Hippocrates, the father of medicine, that all the diseases arise from the gut. This shows how much important the gut immunity is essential. And when I speak about gut immunity, I want to mainly focus upon gut microbiota. Gut microbiota means all the microorganisms which live inside our gut. See, gut microbiota is described as an indispensable metabolic organ. And you know, it is 100 times more metabolic than liver, because it produces certain metabolites which are of utmost importance for the host metabolism. Similarly, gut microbiota is a complex ecosystem, because many people think that gut microbiota contains only bacteria. No, it contains even other microorganisms also, like virus, bacteria, yeast, fungus. But the predominant microorganisms are the bacteria. And you know that one beautiful part of this gut microbiota is they can regulate and modulate the genes which are responsible for the immunity of the gut, and also they help in energy metabolism, nutrition absorption, and they maintain the integrity of the intestinal epithelium. And above all, there is a very good symbiosis between the host and the gut microbiota, because gut microbiota produces many essential amino acids and vitamins which are responsible for the gut health. And also, gut microbiota, they act on the carbohydrates and proteins and liberate many short chain fatty acids which are very essential for the absorption of certain trace elements like calcium, magnesium and phosphorus. And most surprisingly to know, gut microbiota also releases certain neurotransmitters. Among them, glutamate, dopamine and acetylcholine are excitatory neurotransmitters. Excitatory means it doesn't excite you, okay, but they excite each and every cell to perform their function. When a cell is becoming overexcited, they control that excitement and see that the target cell functions properly. So with all this, I think you have understood what an important role gut microbiota has to play in maintaining the gut immunity. And in Ayurveda, we are blessed with certain drugs which have undergone research and were found that they have a very good gut microbiota modulation activity. And a few of them are Lasuna, Dadima and Draksha. And these three are also said to have improving the brain function, and also they are anti-stress in their action. So when we come to the clinical implications, when we sit in a clinic, frequently we get certain cases like irritable bowel syndrome and peptic ulcer disease. So when we see irritable bowel syndrome, clinically we see two types of patients coming with irritable bowel syndrome. They can come with constipation predominant irritable bowel syndrome, or they can come with diarrhea predominant irritable bowel syndrome. So suppose a patient comes to you with constipation predominant irritable bowel syndrome, I advise to prescribe Lasuna Erendadi Kashaya, because Lasuna Erendadi Kashaya is Grahanihara, Anahara, Vibandahara, and also you have seen that it is having a major role to play as a gut microbiota modulator. Similarly, if a patient comes to you with constipation predominant irritable bowel syndrome, in such cases your drug of choice should be Lasunadi Vati, because Lasunadi Vati is indicated in Grahani, Atisara, and also you can see the properties of gut microbiota modulators. And the next disease is peptic ulcer disease. So peptic ulcer disease presents with a wide range of symptoms, from lack of appetite to nausea, vomiting sensation, hematemesis and peptic ulcer. So suppose if a patient comes to you with a complaint of lack of appetite associated with nausea and vomiting, for such type of patients, Drakshadi Churnam is the best drug of choice. But if the patient comes to you with complaint of hematemesis, along with nausea and vomiting, if the patient is coming with the hematemesis, then you can have Drakshadi Kashaya, because Drakshadi Kashaya is Amla Pittahara and at the same time it is Udvagata Rakta Pittahara. And suppose if a patient of if a patient is coming with established disease of peptic ulcer disease, Dadi-Madi-Gruta. Dadi-Madi-Gruta is a very wonderful disease which can be given in peptic ulcer disease because we know the role that the ghee plays in inflammatory lesions, and Dadi-Madi-Gruta is very well indicated in Parinamashula and Anantravashula. And we all know that peptic ulcer disease nowadays is mainly stress induced. So if you take Dhatri Loha contains Amlaki, Estimadu, Guduchi and Loha Basma. So if you see Guduchi and Estimadu are Medhya Rasayanas. So whenever peptic ulcer disease is stress induced, you can nicely prescribe Dhatri Loha to that patient. And one research had recently shown that Tvak Churnam, cinnamon, Tvak Churnam is very helpful to prevent H. pylori infections. So we all know that H. pylori bacteria is also one of the cause for the peptic ulcer disease, and whenever such cases come to you, along with your prescription, please add up Tvak Churnam to your prescription. It will help in the management of such diseases. So as gut immunity is very important, predominantly even neuroimmunity also plays a major role. And you will be very astonished to know that nervous system is equipped with a special immune mechanism when compared to the peripheral immune mechanism. This is because of the presence of glial cells in the nervous system. Glial cells, see, normally when we think of nervous system, we think it is only the nerve cell, neurons. But other than neurons, there are specialized cells in the central nervous system called the glial cells. These glial cells, they do not take part in the functions like transmission of electrical impulses and all. No, their main function is to contribute to the immunity of the nervous system. And above all, central nervous system is an immunologically privileged site. This is because central nervous system has special features like presence of blood-brain barrier, and it also has a lack of antigen presenting cells. And another important thing is central nervous system has many soluble anti-inflammatory modulators. That is why CNS is a most privileged site. So when we come to the clinical implications, there are certain researches that have taken place, and a few drugs have been found to be very helpful as to play an important role in neuroimmunity. When we see ashwagandha, certain researchers have shown that ashwagandha has a very good neuroprotective action and a nootropic action. Neuroprotective action means when ashwagandha was researched on the tumors of spine, it was found that ashwagandha had helped in the formation and elongation of the dendrites and the axons. See, this property may help to repair the damaged neuronal circuits when in the cases of injuries to the central nervous system. And moreover, ashwagandha is nootropic. Nootropic means it enhances the memory and the learning abilities. So, ashwagandha can be very well given in certain conditions like amnesia. What is amnesia? Amnesia is loss of memory due to profound loss of memory due to injuries to the central nervous system. Ashwagandha can be very well given in conditions like Alzheimer's disease. As aging process, memory capacity will decrease. So, in Alzheimer's disease also, ashwagandha can be given. Ashwagandha can be given in simple conditions like even dementia, which we normally see, it will be popping up at the age of 30 to 40 years only. So, next one is Guduchi. We know Rasa Guduchiasu Samula Pushpaha, and it is one of the important major rasayanas that is described in Ayurveda. And one important research has shown that Guduchi reverses neuron degeneration. An animal study on rats have shown that Guduchi helped to regenerate the hippocampal neurons which were damaged by giving an immunosuppressant drug. And if you see, Guduchi is also anti-stress in action. It had exhibited this anti-stress when exposed to serum cortisol and corticosterone levels. And according to Rajanigantu, Guduchi is Deepanam, Chakshusham, Dhatukrit, Medhyam, and Vayahasthapana Karakam. So suppose if you take Guduchi, if you take multiple sclerosis, I think you all know multiple sclerosis is an autoimmune disorder. It is a chronic autoimmune inflammatory disorder in which the myelin sheath of the nerves of the brain and the spinal cord are damaged. So it is an inflammatory disorder. We all know that Guduchi is a very good Pitta Samaka Dravya. It is very anti-inflammatory in action. Now, multiple sclerosis presents with some peculiar symptoms like optic neuritis, loss of muscle tissue, decreased cognitive functions, and neuron degeneration. Now come to Guduchi slokam which I have told. Guduchi is Deepanam Chakshusham. It acts in optic neuritis. Guduchi is Dhatakrit. It acts in loss of muscle tissue. Guduchi is Medhyam. It acts in cognitive functions. Guduchi is Vayahasthapana Karakam. It corrects the neuronal degeneration. That is why Guduchi preparation should be in your prescription whenever you are treating a patient of multiple sclerosis. Next is Senkapushpi. So Senkapushpi you all know, Medhya, we